This is Gateway 101. We have been talking about edema since last night, but last night we couldn't dwell much on it because it was really late when we started. So this morning we talked about it for a minute. We do say something about it. We did part of it. So, but this night we're gonna go deeper. What are the causes? What is edema? What are the causes? And whole remedy for it? And um, and simple home tip, simple tip to help elevate edema. Okay, so this is what we're going to be dwelling in our today broadcast. This is Get Well 101. Okay, so for the sake of those who have not been able to to participate in this broadcast, because we've been on since last night. Like I said, but we just touched a little bit. For the sake of those who have not been able to dwell in this topic, we will brush through. Okay, we'll brush through it again and recap and give some keynote so that you can better understand the part three of the edema. Okay, so without wasting much time, let's dive into it. So the question is, what is edema? Edema, Edema. It is also pronounced edema. Edema. It's a swelling caused by extra fluid trapped in the body tissue. Basically, when fluid leak out of the tiny blood vessel and build up under the skin, you get puffiness or swelling. That is edema. So we're also going to be looking about the common places in the human body where it is most common. So most common place, like as we have said before, is the feet and ankle. That is the most common place where you can notice edema. Your feet and your ankle. So another common place again would be your legs, your hands and arm, face, especially around the eye. Abdomen, you have fluid build up inside your belly. Okay, so please do not forget to subscribe. Please subscribe, share, and like. Subscribe, please do not forget to subscribe to my YouTube channel. This is Gateway 101. Subscribe, please kindly subscribe. So what does it look like when you have swelling in your feet? What does it look like? You have swelling in your feet or in the ankle. You will notice some puffy skin. Skin may look stretched or shining. As for pitted edema, if you press the swelling area with a finger, it leaves a dent for a few seconds. So you have this feeling of heaviness or tightness around the swollen area. Sometimes discomfort or reduced movement. So let us examine the common causes of edema. Edema can happen for any reason, including mild or temporary causes. So let's look at the mild and temporary causes of edema. Okay, so okay, so edema can happen for many reasons, including standing or sitting for too long. Okay, when you sit for a very long period of time, mostly if you are traveling, have a 16-hour flight, you sat for a long period of time, you can have this fluid build up in your foot and ankle. Those are mild and temporarily. They will subside immediately you start walking, or they will subside immediately you do some stretch. Those are mild, those are temporarily. Okay? Eating too much salty food can also aggravate it. Okay, if you eat too much food, you can also have a lot of fluid buildup in your lower ankle. Pregnancy, most pregnancy come with swollen foot and ankle. So but if it is not medically related, it will definitely subside after delivery. Hot weather is also a contributing factor. Okay, so let us look at the medical causes of edema. Okay, I will say that the medical causes of edema uh, can be fatal if it is not properly treated. Please subscribe, like, and share. Subscribe, like, and share to my YouTube channel. This is Gateway 101. Please kindly subscribe and share. This is Gateway 101. So if it is medical, if the edema is if it is medical related, it can be fatal if it is not properly treated. So medical cause of would be like heart failure, poor pumping lead to fluid buildup. If your heart is not pumping effectively, this will lead to a fluid buildup. Kidney disease, kidney failure can also lead to fluid retention. Fluid not properly removed. Do not remember that the kidney filter the excess fluid and will urinate them as waste. So, but if the kidney fail to function properly, and so you will have a full retention because of the kidney ability to filter this fluid. So what you will see will be a fluid buildup in part of your body. This is a medical causes and need medical attention immediately. Liver failure, low protein level causing swelling. Yeah, if you have a low protein level, it causes swelling. Okay? Venous insufficiency. So when you have like weak leg vein, if your weak leg vein, if the vein in your legs are weak, it can also cause edema. So blood clot is another contributing factor to edema. Certain medication can also be of contributing factor to it also be another contributing factor to edema, such as steroid. If you are taking steroid or you're taking some blood pressure pill, this medication over time can retain fluid and you end up having a edema, especially in your leg and around your foot and your ankle area. So when edema is serious, seek a doctor urgently. Okay, so remember what we do in Gateway 101. We place emphasis, we create healthcare awareness, okay, and we'll give you a simple home remedy to help elevate these illnesses. That's what we do with Gateway 101. Our emphasis is to educate the public, creating healthcare awareness. Okay, so we are saying here that this does not constitute diagnosis or treatment. Okay, so get that straight. This does not constitute diagnosis or treatment, but these are some simple signs and symptoms that if you notice them within you, you should seek medical attention. Okay? We don't diagnose in Gateway 101. We don't diagnose, but we test you some of the symptoms that you may notice in your body, and we are saying that if you notice those symptoms in your body, seek medical help. Okay, that's all we are saying. We're creating healthcare awareness. That's all we do. Okay, and we'll give you some simple tip. Prevention is better than cure. That's our emphasis. Okay, so get that clear. So when edema is serious, seek medical urgency. Get quick check if swelling is sudden and painful in one leg. You suddenly notice a swelling in your ankle, in your feet, in one leg, get medical help immediately. Okay? Or you notice shortness of breath or chest pain. If you notice that, please seek medical help immediately. Okay, so seek medical help immediately. Okay, you have severe, worsening, or unexplained swelling, pain, seek medical help immediately. Okay, so if this is associated with your kidney, your heart, or your liver problem, seek medical help immediately. Okay, for the sake of those who are just joining us, this is Gateway 101. In Gateway 101, we place emphasis on prevention because we believe that prevention is better than cure. There are so many issues, healthcare issues, that if you seek medical help on time, it can be addressed quickly. But if you don't do that, it might cost you more. It will also cost you time. So that's why in Gateway 101, we'll also have the little way of saying thank you to our community where we live. We provide free transportation to those who cannot afford it when going to their doctor appointments. Reach out to us, we'll send transport down there and take you to your doctor appointment because we strongly believe on prevention because prevention is better than cure. That's why we place emphasis on encourage people to go for their screening, go for their routine checkups. Okay, you can feel healthy, but you may be surprised what you got, but you may not know because there are some certain illnesses that don't show any symptoms at all, and when they strike, it can be fatal, such as high blood pressure. Okay, so for the sake of those who are just joining us, we're going to recap again. So we'll run through of what we'll be saying. So we're saying that edema is a swelling caused by extra fluid trapped in the body tissue. We also said that basically when fluid leak out of the tiny blood vessels and build up under the skin, you get puffiness or swelling. That's an edema. So I will say that the common place where this may most likely happen in your body would be your feet and ankle. Those are the most common place. Your legs, hands, and arm, your face, especially around your eyes, your abdomen, fluid build up inside your belly. I will say that what does it look like? We'll say that you will notice a swelling, you will notice a puffiness, your skin may look stretched and shiny. Why pitting edema is that when you place a finger on that swelling area and take off your finger, you will notice a dent, okay, for a few seconds. Okay, you feel heavy and tightening, sometimes discomfort and reduced movement. And we also said that the common cause of edema will be, it can be mild or temporarily. I would say that if it is mild and temporarily, that would be when you sit for a very long time or standing for a very long time can cause fluid to build up in your ankle and your foot. Eating too much salty food, we say this can also be a contributing factor to mild edema. Pregnancy can also contribute because of so much blood and fluid involved during this period, but it should subside after delivering. Okay, unless there's a medical it should evolve. We also said that hot weather can also be a contributing factor. And we also look at the medical causes of edema. I will say that heart failure, poor pumping leads to a fluid buildup. People with kidney disease, fluid will not remove properly because because of your kidney ability to filter out excess fluid, which will normally urinate out as waste. So if you have a liver problem, you have low protein level in you, this can also cause swelling. Venous insufficiency, your leg veins are weak. You can also have fluid buildup in your ankle or in your foot. We also talk about blood clot can also be a contributing factor. Blood clot that get to do with injury. Okay, it can also lead to a blood clot, and this can lead to edema. Certain medications like steroid, overtime use of steroid or blood pressure medication can also cause fluid retention. This will cause edema. So when we say that edema is serious, when edema is serious, we say seek medical help immediately. Okay, so I will say that sudden and painful in one leg. Okay, if you notice sudden and painful in one leg, seek medical help. I also said that if you have shortness of breath or chest pain, these are medical emergencies. Seek medical help. Severe, worsening, or unexplained pain associated with your kidney, heart, or liver problem. We also say that seek medical help. And we're also going to be talking about some simple, we're also going to talk about what causes edema. What are the main reasons? What are the major causes of edema? So let's look into that first. Then we'll talk about simple home remedy to help alleviate temporarily edema. Okay, so why simple home remedy may not work for medical edema, we strongly encourage you to seek medical help in regarding that. But for mild and temporary edema, a simple home remedy will help alleviate that. So what are the possible causes of edema in the foot? I would say that edema in the foot, that is swelling caused by fluid buildup in your foot, can happen for a lot of reasons. Some are harmless and temporarily. Others are more serious. The key is figuring out what's causing the fluid to collect in the lower leg and foot. That's the key issue here. And we're saying that standing or sitting too long, this is one of the most common and harmless cause. Okay, if you stand or you're sitting for a very long time, long hour on your foot can also cause fluid buildup. Okay, sitting for long period, like during traveling, you have 16-hour flight. Definitely, you might notice a temporary edema, but that should subside as soon as you start walking around. Gravity pull fluid into the feet, which usually improve when legs are elevated. So injury or inflammation can also cause fluid to build up in your foot. Okay, so swelling in one foot is often due to strain or fracture, bruising, tendon or ligament injury can also cause edema. Insect bite or sting can also cause edema in your foot. Often come with pain and redness if it is an insect bite. Also talk about poor blood circulation, venous insufficiency. When leg vein does not return blood properly, fluid leak into the tissues. So the signs will be, you will notice swelling worse at the end of the day. Varicose vein can also cause poor blood circulation. You have weak vein in your leg, it can cause poor blood circulation because the major artery that carry blood to the brain is from your legs. So if there's no proper circulation, definitely you will notice swelling. So you will notice another sign will be skin discoloration around the ankle. Yeah, be a skin discoloration around the ankle. So heart problem, heart failure. If the heart is not pumping effectively, fluid backup in the legs. Okay, so the common clue here will be swelling in both feet or leg. Okay, shortness of breath, fatigue, weight gain from fluid retention. This need urgent medical attention. Okay, so kidney disease can also cause fluid to build up in your feet. So kidney help remove excess fluid, as we know. Kidney filter excess fluid and urinate them. So, but if there's a kidney problem, have a kidney failure, yeah, if they are not working well, definitely there will be a fluid buildup in the body. So swelling may occur in feet, face, or hand if you're having a kidney problem. Often linked with change in urination. Okay, yeah, if you're having a kidney disease. Liver disease can also cause swelling. Okay, so liver problem can lower albumin, a protein that keeps fluid in blood vessels. So the main causes of this will be leg swelling, abdominal swelling, yellowing of the skin or eyes. So, edema, when your nephro is blocked due to injury or other certain medical condition, fluid will build up when nephro vessels are damaged or blocked. Common feature will be persistent swelling. It will be persistent, and your skin will be tingling. Often affect one or both legs. This can occur after surgery. It can also occur after cancer treatment or an infection. Okay, blood clot, DVT, is a serious medical issue. A very serious medical issue, usually on one leg. If you have a blood clot in your leg, please do not hesitate to go to the nearest urgent care. Okay, so the warning sign for DVT, deep vein thrombosis, DVT, the warning sign will be sudden swelling in one foot or leg, suddenly, very pain and tenderness, warm to touch with redness. This is an emergency because clot can travel to your lungs. Pregnancy, like we said, pregnancy can also cause swelling of your feet. Swelling is common due to increased blood volume during pregnancy, pressure on your leg vein. However, sudden swelling with headache or high BP may signal preeclampsia that requires medical attention. If it is temporarily, it should subside after delivery. So medication can also be a contributing factor to feet edema. Some drug causing fluid retention, including calcium channel blockers, your BP medication, or steroid, can also cause that. NSAID, like ibuprofen, can also cause fluid retention. Hormonal medication can also cause fluid retention. Certain diabetic drugs can also cause fluid retention. Excess salt intake, too much sodium make the body hold onto water. Okay, so swelling may worsen after certain meal. Note that swelling may worsen after certain meals. So if you're already having a fluid retention, it might worsen after eating a certain meal. Obesity, extra weight increases pressure on the vein and nephro vessels, so leading to swelling. So 10 to 50% weight reduction will go a long way to help you at this time. Infections can also be a contributing factor for fluid, for fluid retention in your field. Food or skin infection can cause swelling, especially in diabetics. So the warning sign will be redness around your ankle and around your feet. It will be warm to touch. It may also come with fever and pain. So when to seek medical help immediately. So we said that go to urgent care or AR if swelling comes with sudden swelling in one leg. When to seek medical help immediately. Seek medical help immediately by going to urgent care or ER if swelling comes with chest pain or shortness of breath. Medical emergency, go to the ER. Severe pain, redness, warm to touch, seek medical help. Swelling with fever, seek medical help. Do not forget that prevention is better than cure. The earlier they caught this, easier for them to treat it, and you'll be fine again. Swelling plus heart, kidney, or liver symptoms that will just make sure seek medical help. Why this does not constitute diagnosis or treatment, we strongly encourage you to do what? To keep to your doctor appointment. We strongly encourage you to go for your routine checkup. Okay, so let's look at some simple home remedy that we can use to help alleviate mild and temporary edema. Let's look at some simple home remedy that we can use to help alleviate simple home remedy to help alleviate edema. While this does not constitute treatment for medical causes, this might help alleviate mild and temporary causes of edema. Okay, edema, swelling from the fluid buildup, usually in the foot, ankle, or leg, can feel heavy and uncomfortable. While some remedy work will not replace, while some home remedy will not replace medical care, as I've just said, if there is an underlying causes, need medical help. But they can definitely help ease mild swelling. Okay, even as much as there's no underlying medical issue or the underlying medical causes as regard your feet swelling in a common term, the simple home remedy will definitely help ease the swelling. So here are some simple, safe home remedy. The number one is elevate the swelling area. One of the easiest fix for temporary or mild edema is elevate the swelling area. Raise your leg above your heart for 15 to 30 minutes. Do this 3 times daily. This hair fluid drip back towards the heart. Then you can urinate it out as waste. Gentle movement or walking is another home remedy for mild and temporary edema. Sitting or standing too long makes swelling worse. So take short walk, do ankle circle or calf stretches. Movement helps pump fluid out of the legs. Easy fix. Reduce salt intake. Too much sodium make the body hold onto water. Okay, so avoid processed food, chips, canned soup. Choose fresh meal when possible. Okay, so drink enough water. It sounds strange, right? But dehydration can make the body retain fluid. Okay, so aim for steady hydration throughout the day. You can also use pressure sucks if it is mild swelling, and if it is mild swelling, if it is temporarily, if there is no underlying medical cause, you can use compression socks. Yeah. So this help prevent fluid buildup in the legs. Best for swelling for standing or pregnancy. Avoid avoid it if you have severe circulation problem, unless your doctor do what approve of it. Eat potassium-rich food. Potassium help balance sodium and fluid level. So good shots would be your banana, your spinach, avocado, sweet potatoes, rich in potassiums. Because potassium help balance sodium and fluid level. Okay, herbal tea would serve like diuretic, gentle diuretics. Okay, some may help reduce water retention, such as your ginger tea, your parsley tea. Use moderate, especially if you are taking medication. Okay, cold compress for localized swelling. You can actually use cold compress for localized swelling. If one area is puff or sore, apply a cold cloth for 10 to 15 minutes. Maintain a healthy weight. Extra weight increases pressure on the vein and worsen leg swelling. Okay, when edema is not a home remedy program, then seek medical attention immediately. I repeat, when edema is not a home remedy program, seek medical help urgently. If you notice swelling in one leg only with pain or redness, seek medical help. You notice shortness of breath or chest pain, seek medical help. Sudden or severe swelling, seek medical help. Swelling with heart, kidney, or liver problem, seek medical help. For sake of you who are just joining, we go to recap. We will recap again, okay? For the sake of you who are just joining, we will recap again, okay? Okay, for the sake of you who are just joining. Okay, so let's recap again. We said that edema, swelling from fluid buildup, usually in the feet, ankle, or leg, can feel heavy and uncomfortable. While some remedy will not replace medical care if there is an underlying causes, they can definitely help ease mild swelling. Okay, so we'll say that here are some simple, safe home remedy. Number one will be elevate the swelling area. One of the easiest feats. Raise your leg above your heart level for 15 to 30 minutes. Do this for 2 to 3 days, 2 to 3 times daily. This helps fluid drip back towards the heart. You urinate it off, therefore causing the reduction in the swelling. So gentle movement or walking, sitting or standing too long makes swelling worse. So take a short walk, do ankle circle or calf stretch. Movement helps pump fluid out of the legs. Reduce salt intake. We said too much sodium make the body hold onto water. So reduce your salt intake. Avoid processed food, chips, and canned food. They contain a lot of sodium. So eat moderate. Choose fresh meal when possible. We also say that drink enough water. It sounds strange, but dehydration can make the body retain fluid. Aim for steady hydration throughout the day. We also say that compression salt, if it is mild swelling, use compressor socks. This helps prevent fluid buildup in the legs. Bakes for swelling from standing or pregnancy. Avoid if you have severe circulation problem unless a doctor would approve of it. We also say that eat potassium-rich food. Potassium helps balance sodium and fluid level. Good choice would be your banana, spinach, avocado, and your sweet potato. These are potassium-rich food. Some herbal tea, tea, can also serve as gentle diuretics. which would help eliminate excessive fluid buildup in your legs, such as ginger, pasha tea. Use moderately, especially if you are taking a medication. We also said that you can use cold compress for localized swelling. You can use cold compress for localized swelling. If one area is puff or sore, apply a cold cloth for 10 to 15 minutes. Maintain a healthy weight. Extra weight increases pressure on vein and worsens leg swelling. So when edema is not a home remedy problem, then seek medical help immediately. If you notice swelling in one leg only with pain or redness, you notice shortness of breath or chest pain, seek medical help immediately. Sudden or severe swelling, seek medical help immediately. Swelling with heart, kidney, or liver disease, seek medical help immediately. This is Gateway 101. Once again, while this does not constitute diagnosis or treatment for medical underlying causes, we strongly encourage you to go for medical checkup. Okay? Do not forget we provide free transportation for those who live in our community who cannot afford transportation to their doctor's appointment only. Doctor's appointment only. Okay? So this is our little way of saying thank you to the community that we live. Once again, this is Gateway 101. Thank you all for watching. Until we'll see you again. Stay blessed. Bye for now.